So peer support is, in a sense, it's a really simple idea, isn't it? It's people helping people helping each other, and the idea of peer suggests some kind of equality between the people who are helping each other. And the idea is often associated with people with disabilities, people with mental health problems, who help other people with mental health problems or with disabilities. Although the idea is also much wider now, so we have professional peer support networks, we have family peer support networks. And it's the powerful discovery, I think, of agency and capacity in each other that makes peer support so effective and exciting. When you're working with somebody who shares some of the same life experiences, you trust each other faster, you understand each other's perspectives better, and getting help and giving help start to kind of merge so that really both of you are benefiting from the help you're giving each other. It's an incredibly empowering process. Peer support, in the way that it's developed, started in a way if you go back to the emergence of the independent living movement in California in the 1960s, we saw people with complex physical disabilities fighting for their disability rights, for their human rights, fighting for the right to be independent, and working out that one of the most powerful things they could do is help each other. And often this led to the creation of what are called centres for independent living. These are kind of hubs of peer support. I suppose one of the things that seems to have happened, though, is that if you're not careful, these kind of services can turn into just another service, maybe a better service, but a service in which a lot of the magic of peer support can start to disappear, I think. In fact, in the UK, we've found that centres for independent living have often become privatised and they're no longer even really controlled by people with disabilities themselves. Or in other occasions, we find that peer support becomes a kind of job. So a statutory service might say, well, we're going to do peer support and we will employ somebody to be a peer supporter, somebody with a lived experience. And again, that's not a bad thing, it's a positive thing, but it's a million miles away from genuine peer support, because really the community of peer support is disappeared over the horizon, and instead what you've got is another professional, somebody with lived experience, often sometimes in quite a difficult environment. So I think the best examples of peer support that we see are where the community of peer supporters is vibrant and alive. And the best example I know of that is PFG Doncaster. So PFG Doncaster is based in Doncaster, which is a city in the north of England, and it emerged in 2010, and it started with the work of an independent social worker called Kelly Hicks. And Kelly left social services. She was frustrated at some of the constraints and problems, especially as in the UK we've seen austerity and government cuts come in, and she was frustrated that ideas around personal budgets and giving people their rights didn't seem to be coming to life. So she brought people together and she asked this very powerful question: what can we do? And as the group began to emerge, a lot of their early work was, and it's an important part of peer support, advocacy, campaigning, putting pressure on the system. But within a year or so, what the group had found was that the really powerful thing they could do was help each other. And one of the first occasions this happened, that this really brought, that the group really came to life in this sense, was one of the group members found herself feeling suicidal, calling for help from statutory services. There was no help. Somebody else was having a crisis at the same time as her, so nobody was available to help her. And at that moment, she reached out back to the group. She got herself, with the support of the group, actually into hospital, but then the group organised themselves to get her out of hospital as soon as possible. And that's when the group started to feel its own power. And over the last, 14 years, that group has grown and grown and grown. So there's over 2,500 people with disabilities and mental health problems in Doncaster, helping each other, organising networks across the city, organised around things that are important to the group, increasingly organised to work both to challenge but also work in partnership with services. The relationship with services, which used to be quite difficult, is now much stronger and better, and services are starting to listen to PFG. They're starting to understand the power of PFG, and increasingly the group is doing amazingly innovative things like providing peer support in crises. The very thing that started the group's existence is now one of the things that they're really leading the world in. So I think we have an awful lot to learn from PFG Doncaster and the power of ordinary people helping each other first. If you like the sound of this, join Citizen Network. Citizen Network is the community that's trying to spread the message about the power of ordinary people and to support the work of PFG Doncaster and the other exciting groups that are emerging to transform our communities. Join them, be a citizen, get connected, make a difference.